Welcome again. In new case, here is the 33 gestational age obstetric exam. First finding is polyhydramnia. The shape of fetal skull somehow depressing from frontal side bilaterally, so-called lemon shape. Here is the biparietal, 33 weeks. There is dilatation of the lateral ventricle, which is a sign of hydrocephaly. 1.7 centimeter in diameter. Again, this is the shape of the fetal skull. Lemon shape, so called. We saw this shape in cases of neural tube defects. Now looking for any possibility for combining spina bifida. There is no sign of spina bifida. There is no defect in the vertebral column. Cross section of the fetal abdomen showing protruding of the fetal liver outside the abdominal wall in the midline. Yes, this is more clear view, which is Omphaloceles abdominal wall defect producing of liver and umbilical cord insertion also noted. It's a female fetus. Fetal face looks normal, nose and lip normal. Again, toward the abdomen to confirm our diagnosis. It's a case of Omphaloceles. Lower limb shows some abnormality. Yes, is a sign of clubbing foot, rotation of the fetal feet, severe internal rotation. Here is trying to show the clubbing foot in more good view. Here is the fetal left foot. Fetal is active, so the exam is still difficult. Placenta anteriorly. And again, here is the dilated lateral ventricle of hydrocephaly and the Omphaloceles. Thank you for watching.